Did you know that by the time you're done watching this video, roughly 20 older adults will have been diagnosed with dementia? That's one every 66 seconds. But here's the most terrifying part. What if the cause wasn't aging, but your medicine cabinet? You were told these pills were safe, routine, even essential. But new research is sounding the alarm. 99% of older adults have no idea that at least one of the drugs they're taking could be shrinking key memory centers in the brain by over 28% in less than a year. Let that sink in. In the pharmaceutical industry, they've known for decades. Yet they're raking in billions selling the same drugs that could be accelerating cognitive decline in millions of seniors. In fact, a 2023 study in neurology and aging research found one class of drugs increased the risk of dementia by 49% in older adults in just 2 years of use. In this video, we're going to reveal the 9 most dangerous drugs that trigger rapid memory loss and dementia, ranked from most commonly ignored to most mind-destroying. And number 3, it's prescribed to millions of people for something harmless, but it can shrink key memory centers in your brain, and you probably have no idea it's doing it. Before we begin, tell me in the comments what medications you take daily and whether you've ever felt a sudden brain fog or forgetfulness. We read every comment and reply with personalized insights. Don't stay silent. It could save your mind. Now, without further ado, let's start with number 9, and don't let its position fool you. This one is in almost every older person's cabinet. It could be fogging your brain before you even feel it happening. Diphenhydramine is that little pink pill millions of people trust to help them sleep, soothe allergies, or relieve cold symptoms. It's cheap, over the counter, and you probably have it in your bedside table right now. You might think you're just taking it to get better sleep or allergy relief, but inside your brain, Benadryl can disrupt the hippocampus, which is the region responsible for storing new memories. Benadryl is part of a group of drugs called Anticholinergics, which block a neurotransmitter called acetylcholine. This is a chemical that helps your brain form new memories and stay alert. The older your brain gets, the more it relies on every last bit of acetylcholine it has. And when this drug interferes with that process, the result can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, older adults who regularly used anticholinergic drugs had a 54% higher risk of developing dementia compared to those who didn't. So how can you protect your memory? First, avoid anything containing diphenhydramine, especially if it's labeled PM, nighttime, or allergy relief. That's often just Benadryl in disguise. And if you're using diphenhydramine for allergies, there are newer non-drowsy options like loratadine, which is commonly sold as Claritin, which don't cross the blood-brain barrier and are much safer for long-term use in older adults. Never stop a medication abruptly, but never assume over-the-counter means safe. Prilosec or Nexium are drugs that belong to the class called proton pump inhibitors, or PPIs. These drugs are designed to reduce stomach acid and are often prescribed for heartburn, GERD, and acid reflux. Many older adults take them for years or even decades because their symptoms return as soon as they stop. But what's rarely discussed is how PPIs interfere with the absorption of vitamin B12, which is a crucial nutrient that protects the brain and supports memory, focus, and mood stability. In a 2016 study published in JAMA Neurology, researchers looked at over 73,000 adults aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. By too aggressively suppressing stomach acid, PPIs interfere with the body's ability to absorb not just B12, but also magnesium and calcium, which are essential for neurotransmission and brain cell signaling. Without them, neurons struggle to function efficiently, causing the brain to have glitches, confusion, and memory lapses that often mimic the early signs of Alzheimer's disease. But the problem goes even deeper. PPIs have also been shown to increase levels of beta-amyloid plaques in the brain, which are toxic proteins that disrupt brain function and are considered a central driver of Alzheimer's disease. The good news is there are safer alternatives. If you're on a daily PPI, ask your doctor if you can gradually taper off with the help of H2 blockers like famotidine, which is sold as Pepcid. While not perfect, H2 blockers are less likely to interfere with cognition. Additionally, chewing on a little deglycerinated licorice, which is a natural compound that coats and soothes the stomach lining, can offer symptom relief without harming cognition. Oxybutynin hydrochloride, which is sold under the brand name Ditropan, is often prescribed to older adults who have problems with urinary incontinence or overactive bladder. On the surface, it seems like a convenient solution. No one wants to deal with the embarrassment or inconvenience of frequent bathroom trips. But this drug works by blocking acetylcholine, which is the same brain chemical disrupted by Benadryl. And unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier more easily and directly affects memory regions in hippocampus. This makes it particularly dangerous for older adults, especially when used for long periods. In a 2019 study published in the BMJ, researchers found that people over 65 taking strong drugs like oxybutynin for more than a year had a 49% higher risk of developing dementia. That's almost 1 in 2. What's even more concerning is that many older adults are never warned about the cognitive side effects. They're just told it'll help with bladder control, not that it could accelerate mental decline. The harms are often mistaken for normal aging. Patients describe feeling foggy, forgetting appointments, misplacing things, or suddenly having trouble following conversations. It's only rarely connected to the drug until the damage has progressed. So if you're taking oxybutynin and have noticed mental changes, it's not just in your head, and you don't have to stay on this drug to stay in control. Luckily, there are newer drugs like mirabegron, which is sold as Myrbetriq, that work through a different mechanism and have shown a significantly lesser impact on memory. These drugs don't block acetylcholine and are generally considered safer for older adults. Statins are among the most commonly prescribed drugs in the world, especially for people over 60. They're meant to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most common. But that's where the problem begins. Cholesterol isn't just a heart issue, it's a brain necessity. The brain is made up of nearly 60% fat, and cholesterol plays a key role in creating and maintaining the myelin sheath, which is a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you might also be starving the brain of what it needs to function. In a 2023 study published in Frontiers in Aging Neuroscience, people over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment, and those on high doses had even more noticeable declines. What's even more concerning is that some patients have reported sudden memory loss, describing moments where they couldn't remember names, recent conversations, or even familiar driving routes. Now, it's important to understand that not all statins affect the brain in the same way. Some, like pravastatin and rosuvastatin, don't cross the blood-brain barrier as easily and are considered less risky in terms of cognitive side effects. If you've been on a statin for years and notice fogginess, forgetfulness, or confusion, it may be time to talk with your doctor about a dose reduction or an alternative strategy. Don't wait until it becomes irreversible. The sooner you act, the better your chances of protecting your mind for years to come. Benzodiazepines, which include drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed drugs for anxiety and sleep problems. They work by boosting GABA, which is the brain's calming chemical that reduces overstimulation. At first, they appear to be saviors. They quiet the mind, soothe panic, and help with sleep. But over time, these drugs become something completely different, a trap. A 2022 study published in the BMJ followed more than 8,000 older adults over a 6-year period and found that those who had used benzodiazepine for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk was even higher for long-acting benzos like diazepam, which stay in the body longer and build up in fatty tissues, including the brain. What's happening is a kind of chemical sedation that slows down neuronal activity. This means your brain stops learning as quickly. It becomes less flexible, less efficient, and more prone to confusion, memory holes, and emotional blunting. Older adults on benzos often describe feeling like they're in a fog, disconnected, or just not themselves. And the worst part is that when they try to stop, withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug seem essential when it's actually the source of the problem. To fix this, here's what you need to do. If you've been on a benzo for more than a few weeks, don't stop it suddenly. That can be dangerous. Instead, work closely with a doctor to gradually taper the dose. Alternatives like buspirone, which is a non-sedating anxiety drug, or cognitive behavioral therapy for insomnia and anxiety, can help restore calm without causing memory loss. Amitriptyline, which is sold under the brand name Elavil, is an older antidepressant that is still commonly prescribed today for pain, insomnia, and sometimes even migraines. On the surface, it may seem like a multi-purpose miracle pill, but beneath the surface, it's one of the most powerful anticholinergic drugs still in circulation, which means it blocks the action of acetylcholine, the chemical that helps neurons communicate, form memories, and stay sharp. In fact, it blocks it so strongly that the effects on cognition are not just possible, they're expected with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers looked at over 3,400 older adults aged 65 and older and found that those taking higher cumulative doses of anticholinergic drugs like amitriptyline over a 10-year period had a 54% higher chance of developing dementia. That's not just a slight increase. It's more than half of the normal risk. What's terrifying is that many patients weren't told that the drug could harm their memory. They were often prescribed amitriptyline for sleep problems or nerve pain, and then they slowly started to notice changes like short-term memory loss, difficulty finding words, and hazy concentration. It doesn't take a high dose to cause problems. Even low-dose amitriptyline taken every night for several years can create a slow, invisible erosion of brain power. The damage happens silently, with no warnings, no symptoms at first, just a gradual decline that looks like aging, but is actually drug-induced cognitive impairment. So if you or a loved one are taking amitriptyline, talk with a doctor about alternatives. For nerve pain, options like duloxetine or gabapentin can offer relief without the same level of anticholinergic burden. For sleep, melatonin or low-dose doxepin, which has a much milder anticholinergic profile, can be used instead. And for mood support, there are newer antidepressants like sertraline or escitalopram that are generally considered safer for the brain. Paroxetine, which is sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety. On the surface, it appears as a modern antidepressant, supposedly gentler than the older generation of drugs. But here's the part they don't tell you. Paroxetine is the only SSRI that has significant anticholinergic properties, which means it interferes with acetylcholine in the brain. This one detail makes it radically different from its SSRI siblings like sertraline or escitalopram. In a large 2021 review published in Frontiers in Psychiatry, researchers looked at the cognitive profiles of older patients taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also found that older adults on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is that it's often prescribed to stabilize mood, but it ends up undermining mental clarity and emotional regulation over time. The solution here is simple but essential. Avoid paroxetine in older adults entirely. The American Geriatric Society has placed paroxetine on its Beers criteria list, which is a list of drugs that are potentially inappropriate for older adults. If you're on it, ask your doctor to switch you to safer alternatives like sertraline or escitalopram, which are better tolerated and don't carry the same cognitive risks. Plus, supplementing with B vitamins, especially B12 and B6, can help support mood naturally. This one is especially alarming because many older adults don't even know they're taking an antipsychotic. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed to treat schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia itself. That's right, these are drugs meant for serious psychiatric illnesses, but they're being used in nursing homes and hospitals for older adults who are simply confused, agitated, or difficult to manage. The consequences are devastating. In 2022, a comprehensive study in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors who were prescribed antipsychotics for behavioral symptoms were 71% more likely to develop a worsening of cognitive decline within 12 months, even if they had no prior history of dementia. Worse, these drugs increase the risk of stroke, sudden death, and severe sedation, which can lead to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These drugs suppress dopamine, which is a chemical not only linked to mood and motivation, but is also critical for executive function and memory processing. When dopamine levels crash, the brain becomes sluggish and unresponsive. This is why older adults on antipsychotics often seem dull, emotionally blunted, or zombified. Their personalities fade away, and family members begin to mourn someone who is still physically present. Correcting this starts with asking tough questions. If you're a loved one or on one of these drugs, ask the doctor why it was prescribed and whether it's truly necessary. In many cases, behavioral symptoms can be managed with non-drug interventions by creating structured routines, reducing noise and overstimulation, treating pain or discomfort, and improving lighting and sleep hygiene. When medications are absolutely necessary, lower doses for shorter periods can reduce the harm. But more often than not, these drugs are used for convenience, not necessity. The tragedy is that many families are never even informed what these drugs are doing. They just see their loved one declining, unaware that the cause is chemical, not natural. This is the hidden danger almost no one talks about, and it's one of the biggest contributors to drug-induced dementia in older adults. You might expect a single drug to top this list, but the most dangerous drug for rapid dementia in older adults isn't a single pill. It's the silent, creeping effect of taking multiple medications with anticholinergic properties at the same time, a situation known as anticholinergic polypharmacy. Imagine this scenario. An older adult is taking Diphenhydramine for sleep, Oxybutynin for bladder problems, and Amitriptyline for pain. Each one alone may cause only mild memory issues, but together they add up and the cumulative anticholinergic burden skyrockets. This isn't just a theoretical concern. In a 2022 analysis published in Age and Aging, researchers followed more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the risk. And here's the worst part. Most of these older adults had no idea they were even taking anticholinergic drugs. When you're blocking acetylcholine from multiple angles at once, your brain doesn't just slow down, it starts to break down. Neurons atrophy from underuse, synapses shrink, and the brain goes into a hypoactive state that mimics Alzheimer's disease. Correcting this doesn't require a miracle. It requires a medication review. Ask your doctor or pharmacist to evaluate your entire list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic burden. There are online tools and professional software that can calculate the cumulative load. Once identified, you can work to deprescribe, slowly tapering off unnecessary drugs, switching to safer alternatives, and rebalancing brain chemistry. This is the most empowering part of this whole video. Drug-induced dementia is often reversible. When the burden is lifted, many older adults regain clarity, energy, and memory function within weeks or months. The brain is resilient, but only if you give it a fighting chance. Polypharmacy isn't just dangerous, it's preventable. And that makes it the #1 hidden medical threat to our aging population's mind. Now, we want to hear from you. Which of these drugs are you currently taking? Have you noticed any brain fog, forgetfulness, or personality changes since starting a new medication? Are you ready to talk to your doctor this week about reviewing your medications? Share with us your experiences and opinions in the comments below. We would love to hear them. Thanks for watching.